Hello everyone, welcome to sqadia.com. I'm Dr. Hena Khan and today we're going to talk about the ocular trauma. So the trauma that can occur to the orbit as well as the structuring that is surrounding the orbit, that basically includes all of the osteology and as well as the musculature that is supporting the orbit as well. It can basically range from minor traumas to major traumas. So we'll be discussing even the minor issues such as corneal aberrations, which can be very slight and they have their symptoms such as the redness and the itchiness of the eyes that is quite succulent or that is quite demonstrable in the traumatic eye. And then we have the other major varieties of the traumatologies that can occur to the ocular structure. So we'll be discussing from the minor to the major ocular trauma that can occur to a person. In the very first section, we'll be dealing with the eye trauma assessment. So whenever you have a patient of trauma, you are going to basically secure the airway, breathing, circulation. That is basically the ABC to any traumatology while we are studying. And we're going to assess the patient in detail. We're going to outline the different epidemiological factors for the ocular trauma in this very first section, and then we'll move on to the facts and the figures that are basically correlating with this ocular trauma. And then we'll move on to the history taking in case of the ocular traumatology. Ocular traumas usually result as any foreign body which can basically damage the structures of the eye or of the orbit, and that can be very devastating for the person. In the very second section, we'll be discussing the eye examination in detail over here. So first of all, there is a preliminary examination which basically includes just the inspection of the structures of the eye, and then we'll be examining the functionality of the orbit as well over here. We'll be discussing the repair over here, ranging from the minor traumas such as corneal ulcers, corneal aberrations, how can they be treated, and then we'll be moving on to the more detailed repairs or more constructive surgeries of the eye. Then we'll be moving to the lacerations. Lacerations can be deep, jagged lacerations as well as minor aberrations, incisions. So it depends upon the trauma that has occurred to the eye. We'll be managing the case accordingly in each and every case of ocular traumatology. In the third section, we'll be discussing the traumatic ptosis. So even after trauma, if there is some sort of a central injury, that is going to result in the ptosis of the eyelid. So any nerve damage is basically going to result in the ptosis of the eyelid. That is basically the drooping of the eyelid, which is termed as ptosis over here. Then we'll be discussing the canalicular lacerations. And along with that, we'll be discussing the repair of the traumatic ptosis. And along with that, we'll be discussing the different complications that can even appear along with the trauma itself. And even after the repair procedures, it can be the complications of the post-surgical complications that can occur in a patient of ocular traumatology. So I hope you want to learn more about this ocular trauma. So do watch the other sections to this lecture as well.